All right. Sorry, I don't want to end any conversations, but we'll be able to come together as a group after to discuss what everyone shared. So I'm going to move forward and hopefully everyone had some fruitful discussions with their partner. So for today's workshop, I will start off by sharing the project background with everyone and again, having that discussion. This was the time I had originally allocated to each section, but we'll try to move through things a little bit quicker. Then we'll work through the workshop activity, and at the very end, I'll save some time for any questions that anyone has about the project or the workshop activity that we do together. So to start off, what are patient-reported outcome measures or PROMs? So PROMs are actually standardized questionnaires that are used by healthcare professionals to learn directly from the patients about their health. And this could be anything ranging from symptoms, how satisfied they are with their care, and how their condition or treatment affects their physical, mental, emotional, spiritual, and or social well-being. So why are proms so important then? So proms are important for several reasons. They can be beneficial to assess patients' overall health, and this can provide valuable insights into the patient perspectives about their health, and it also gives patients a voice. Proms are also great for improving clinical experience because they can be one way to capture what traditional clinical assessments may miss on their own. And it is also a very, very great way, an excellent way to incorporate patient voice into research. And with patient voice, you can always enhance patient-centered care and improve overall healthcare quality as well. So I was wondering, maybe we can start with Ivana, and then after, if anyone wants to share what they discussed about, the kinds of topics that you wish you could have discussed with healthcare professionals about your RB experience.
So I come from a parent perspective, and this group has a patient and survivor perspective. So slightly different, but what I wish I could have discussed with healthcare professional would be some little things that I found my son was doing that were, I just wanted to know what it meant. So little things like always touching his eye where his prosthetic was and touching his lashes, and his hands are always on his face. So this was something I wanted to talk more about with someone and get a better understanding of, like, is this an RB thing or is this a normal kid thing? And is he doing this because he's trying to tell me that there's a problem with the prosthetic or something that he's not verbally explaining in a way to get me to act in the right way? So that's one example of something that I just didn't feel fit into any specific category of, like, ophthalmology or psychosocial or something. It was just these weird things, I'd call them. One example.
Thank you for sharing, Ivana. Did anyone want to add anything to that or share their own thoughts?
It's Serene. Can you hear me?
Yes.
Oh, okay, perfect. So my thing was, once I was I guess 18, when I was done with my follow-up and from a sick kids hospital, I would have really appreciated being connected for follow-up instead of later, for me, like, to find out afterwards when I was diagnosed with my second cancer that because I had RB, that I was a candidate for developing other cancers later in life. And then I kind of had to do my own advocating or researching or finding out and stuff like that. So that continuum of care would have been fantastic,
Thank you for sharing that, Simreen. Anyone else have similar experiences to Simreen or Ivana or want to share anything else before we continue
Hi,
on?
hi,
Hi.
Angus here.
Yes, we can hear you.
I just want to say that I found this question interesting because as someone who has RB, you grow up with it and it becomes normalized for you. You don't necessarily think about what questions should I be asking healthcare professionals. When you see them, they talk to you, especially when you're younger. They talk to you somewhat as a child or youth, you don't necessarily feel you can ask those questions. And then as you get older, it's so normalized, you don't think of questions to ask. I found that as I had my child, who was also an RB survivor, that brought up the questions that I could ask. And I started asking those questions when my son was going through treatment rather than my own treatment. But they're not necessarily the same experience, right?
Yeah, thank you. Thank you for sharing that. Um, Anyone in Toronto want to share or?
It's interesting as we chat about this, maybe like this theme of knowing what to say when it comes to, I brought up this example of dental professionals when I go into the dentist and they're like, hey, go take an x-ray. And I don't really know how to respond to that, right? Especially early on. But then, to Ivana's point of like the little things, there are these things around like even now recently with my optometrist, another care professional, where he's like, hey, you should probably be wearing sunglasses outside. And I'm like, I don't do that. And this is like a year ago, And so you even just like best practices of, across different functions like optometry, dentist, like the things that normally affect us in everyday life of how does RB shift that the normal, let's say, quote unquote, normal person's experience, like, or two-sided person's experience, right? Like driving, like what should we be considering there? Because like I've been driving for years, and it wasn't until like last visit with my optometrist when he's like, hey, did you know that you have a big ass blind spot in the right corner or left-hand corner? And I was like, oh my gosh, this is why I've actually had a few like close calls. But now that I know that, I know I can err more towards double like shoulder checking in that one spot because I know it's a blind spot. And so all of the awareness is kind of like, how do you normalize everyday activity? Mm-hmm.
One of the conversations we had out here was partly about the ongoing need to have maintenance follow-ups, to have visits not being recognized by your employer as legitimate time off, right? You can't go have your checkups or your injections or whatever it is you need because you have to take a sick day or just no pay. I don't know if anyone else has a problem with that, but that's still a little shocking in modern society and hard to fight against.
Of course, thank you for sharing that. I would like to thank everyone for sharing all the different topics and concepts that they wish they could have brought up with their healthcare professionals. And this is exactly why we want to develop proms, because proms are questionnaires where some of these things may come up, and patients may now have the opportunity to answer these or talk about these things in the questionnaire, which then can guide conversations between patients and healthcare professionals. So to delve into proms specifically for the project that I'm working on, I just want to go over this project background circle with everybody. So the way this project started out was a few years back, we noticed that there are no proms for the retinoblastoma population. But if you want to create a prom or questionnaire for RB patients, the first step is to really understand, well, what should these questionnaires be about? And so a previous master's student in Dr. Damaris's lab actually had focus groups with retinoblastoma survivors and with parents. I'm not sure if anyone here had the opportunity to participate in those focus groups, but from those focus groups, we actually learned about a lot of treatment outcomes that are important to retinoblastoma patients. And some of these treatment outcomes were around daily functioning, quality of life, appearance, psychosocial needs. But there's so many treatment outcomes, you would need multiple questionnaires to really discuss every single one of these topics. So as a starting point, one of the treatment outcomes that we decided to focus on was appearance. The reason we decided to focus on appearance social treatment outcomes was because instead of developing a questionnaire all the way from scratch, which could take a very, very long time, there is currently a prom or questionnaire known as the FACE-Q, which was actually developed for patients with craniofacial conditions. And that means any patients with any abnormalities in the face or in the head. But the phase Q, it was made for patients aged 8 to 29 to report on their appearance-based outcomes and how it affects them psychosocially. And it also had sections about the eye. And so we thought, you know what, why don't we take these quality of life sections, why don't we take these eye sections and see if they may actually be helpful for the retinoblastoma community. And so to do that, oops, I actually just went through this, I'll skip this. To do that, what we did is I interviewed retinoblastoma patients as well as parents. Not sure if anyone here had the opportunity to participate in those interviews, but in the interviews, I went through the questions in those sections of the prom, so the health-related, the quality of life sections and the eye sections. And I interviewed patients and I asked them, you know, are these questions easy to understand? And based on your experience, are these questions relevant? And of course, craniofacial experience is so different from RB experience. So are there any aspects of your experience that's important but missing from these sections of the questionnaire? Now, taking all of that feedback, I then worked with patient advocates like Ivana and Genevieve. I worked with clinicians, and I also worked with scientists to take all the feedback we got from the patient participants and to then modify this phase Q to make it more RB specific. So we actually have the modified version ready now. All of the content is there. And now we're in the phase of the project where we are going to be field testing this prom. And what that means is we're going to need hundreds of patients around the world to complete the survey. So then based on their answers, we can really work on shortening the questionnaire. What does that mean? To really include only the most effective questions in the questionnaire so that it's not a burden on the patients to fill it out, but also so that clinicians can quickly look at the questionnaire, find the score, kind of see where the flagged areas are, and use that as a means of guiding certain conversations or even maybe addressing any psychosocial needs, for example, that may not come up otherwise in the clinic. So how do you know which questions work the best? So I'm going to slowly go through this rationale, and if you have any questions, please do jot them down and save them for the end of the workshop. But let's say Even and I were doing a math test, and Ivana got 7 out of 10 and I got 7 out of 10, but that doesn't really tell you anything about our math skills because maybe Ivana got the hard questions correct, but made some silly mistakes in the easier questions. But maybe I got the hard questions wrong, but got all the easy questions right. So 7 out of 10, just adding up all the math scores doesn't really tell me anything. So the way we want to develop this questionnaire is we want to make it like a ruler where you have sorry, let me see if I can get the pointer up here. There you go. So where you can have the difficulty of the questions on one side and you have the ability of the person on the other side. So to start off, I'm going to give you an example of what this means with an IQ test example, and then I'll translate that to show you how that would work in an appearance-based prom or questionnaire. So bear with me. So the way these questionnaires are supposed to be designed are you have all the easiest questions on the top, and then you have the most difficult question at the bottom, and each of the questions kind of increases in difficulty at an equal level of difficulty. So for example, if we had an IQ test here, you would have a really easy question that most people should be able to answer, and then a really hard question at the bottom that maybe most people are not able to answer. And you go down this ruler in increasing level of difficulty. On the other side of the ruler, you have the ability. So someone who has lower IQ may score better for the questions on the top, whereas someone with high IQ will score really well all the way down to the bottom. Hopefully that makes sense so far. So how does this work in an appearance-based questionnaire or prompt? So in an appearance-based questionnaire, you have questions that people who are least satisfied with their appearance would answer highly at the top. And you have questions that only people who are very, very satisfied with their appearance answer highly at the bottom. And throughout the ruler, you have increasing level of satisfaction. And the point where individuals stop answering highly is where their level of satisfaction is. So I hope that kind of makes sense. And another thing that we want to do is we want to make sure that all of the questions in the questionnaire are consistent across all patients. What does this mean? So this means that regardless of factors like age, sex, ethnicity, the question should be the same and relevant to everybody. So you can see an example here. I have this question: I worry about my appearance when meeting new people. So this can be interpreted by everyone in the same way and applicable to maybe everyone. They'd be able to answer that. Yes, I do worry. No, I don't worry. But a question like, I worry about how my appearance will impact my dating life, isn't relevant for everyone because maybe due to age, people aren't interested in dating, or maybe due to other factors, or maybe even their culture, dating's not a thing. So a question like this wouldn't work well, even though it may be relevant to a subgroup of the patient population. So what will happen is once we have all these statistics from all the patients around the world who complete this modified FACE-Q that we have, we can then really pick out which of those questions don't work based on the concepts I just showed you, and then keep only the questions that do work. So then after, we can go on to validate it, make sure that it's actually measuring what it's supposed to measure, and also to make sure that with many patients completing this questionnaire, that consistent results or consistent scores are obtained. So that's kind of a little bit about the design of the questionnaire. But what we're going to do today is, just because the statistics or the math tells me that a question doesn't work well, doesn't necessarily mean that I should remove it. Because according to patient lived experience, that question may still be important. So it's important to include not just all the math to make sure that the questions fit that ruler, but also incorporate patient perspective. So what we'll do today is we're actually going to go through the questions in the questionnaire. And first, everyone's going to have an opportunity to complete a Google form with a section of the questionnaire, and you're going to assign each question whether you think, based on your experience, if the question is important, if the question is not important to ask to patients, or maybe you're not sure and you have a more neutral perspective. So everyone's going to take about 5 minutes to do that. And then we'll come together as a group, and any question that at least one person has indicated to be neutral or not important, we're going to discuss to come to a final consensus to decide what assignment we should give it. Should we keep it? Should we drop it? Or are we unsure? And after we discuss, we'll then come to a final vote for each question. And what this will do at the end is, when I see using statistics which questions don't work, I can come back to the discussion we had today and then decide, maybe we actually should keep this question even though the statistics shows it's not good because it's important. Or maybe this question didn't work well statistically, but the patients also don't really like it, so let's remove it. So I hope that kind of gives everyone a picture of what's happening today. So
Can we ask one question?
yes, of course.
So the notion behind an appearance one has the combined factors of the factual amount and then the sort of psychosocial perspective of the individual.
Mhm.
And it's possible that that may change during their lifetime,
Yeah.
or in certain circumstances, or that similar things would get a different response
Mhm.
from two different people. And is that taken into account, or it's decided that none of it matters?
No, that is very much taken into account because everyone's life changes over the period. And so really, in order to encompass as many perspectives as possible in designing this questionnaire, that is why that testing period where I said we need hundreds of patients around the world to complete it, that's why it really matters, because we want to be able to capture those differences. We want to be able to ensure that, a difference in score, unlike the 7 out of 10 example that I showed you earlier, the difference in score actually means something in terms of a patient's appearance satisfaction. Does that kind of answer your question?
Do you take into consideration the parameters around when you're asking how someone feels about themselves, not just where they are in their life? Because different situations may affect your confidence, and your confidence is what allows you to feel comfortable in your own skin, but that may be affected by the different situations that you're in, right? As opposed to hanging out with family compared to going to a fancy gala ball. You may feel differently about yourself around those people than you do around people you know.
Yeah, you're completely right. And as we go through the questionnaire, you'll see that we've tried to cover all of that.
Right. See what they do.
Okay. All right. So the first section of the questionnaire that I encourage everyone to complete is this appearance of the eyes section. For any of you who are unable to use the QR code, we are putting in a link in the chat. So once I'll give everyone about 5 minutes or so to complete this, and then we'll come together to really discuss the questions that we see don't work well.
Does anybody need more time? If anybody needs more time, if you could just unmute and let us know, and we'll give a few more minutes.
Mhm. Yeah, I'm done.
Okay, so looks like we're ready. So the results are in. So does everyone still have, I guess I can, actually, sorry. See what I can do. All right, so the results are in. So we can see for the first question, how much do you like how well your eyes match your face? We actually have 2 individuals who thought maybe and 4 individuals who thought, yes, it's a good question, we should keep. So I was wondering if anyone who selected maybe can explain why they chose maybe based on their experience, and then an individual who chose keep to discuss why they may have chosen keep.
I was one of the maybes.
Do you want to?
I think I chose maybe for this one because the word, what is the question again? Oh, yes, match. So for me, I guess the term matching your face is, I felt very subjective, and that it wasn't something that I could say concretely. Because I think a match is a very difficult thing to agree. Maybe if I was someone from years ago who had radiation treatment and there was some shrinking, or the size of the socket might have changed, but I don't know, I just didn't feel that the eye had relevance to matching your face. But that's my own experience.
Thank you for sharing that, Genevieve. Does anyone else want to share their thoughts on that? No? Okay. So I guess, since we can do a final vote then for this question. So for in person, you have a keep maybe drop paper in front of you, and for individuals online, if you could please use the thumbs up for keep, thumbs down for remove, and the hands up for neutral. And for our friends in Vancouver, we can look for your thumbs up. You can do it physically, and we'll try to do our best there. So yeah, for the first question, now that we've heard Genevieve's perspective and also taking your own perspectives into account, can you please put in the emoji or use your thumbs or use your papers to show what your final decision about this question is?
And if anybody
Thumbs up.
does not want to use the emoji, you can unmute and just vote verbally, those who are virtual.
Personal question, but it is relevant to how you look at yourself.
Still, I feel like this is a duplicating one too. Right? Where we're trying, I don't know if it's easier to vote every time or at the end, but it's hard to compare it to the other ones as well. Because I feel like sometimes we're duplicating our question.
Mhm. So I'll actually talk about that. That's okay. So you may see some redundancy in the question, and that's because when we do the statistics, actually, if you have less questions you start off with, you can only remove questions at that point. You can't add questions. And if we notice that we don't encompass the entire ruler, that's not a good position to be in. So we prefer to have as many questions as possible, because we can then cut down. That's no problem based on the stats and the patient's experiences. So if you do notice some redundancy, please do note them, because then I'm aware when we get to the statistical part. But just so you're aware why. Okay, so I think we have our
Oh,
number.
sorry, I just
Oh,
wanted to
sorry.
confirm if anyone else on virtual who did not vote to let us know if keep, maybe, or drop, if you wanted to unmute and we could count you verbally.
It's Serena, keep, I'll take keep.
Thank you.
And I just want to be clear, even though I'm in the room, I'm a healthcare professional and not voting.
You're free to vote as well, Dr. Payton. But if you don't want to, that's okay.
We only
I
have,
thought I should stay out of it.
we only have one thumb though.
You can use your own, like your physical thumbs as well. We can see it.
Oh,
So,
fair
yeah.
Just a comment about keeping all of them. Like, I wonder if there's a question more so. Is there any way to like super emphasize or emphasize that something is actually like where I'm like, oh, actually that question resonates a lot. Kind of like how in Netflix, if you actually take action to say like, I loved that show, you know, someone actually liked it, as opposed to like, I could be neutrally saying keep them all, like it's fine, but there's no like emphasis on importance or like how much that question
best
sticks
one
out to
kind of
me.
thing.
Yeah,
Sure.
the best one.
Sure.
Yeah. Any comments on that?
There you go. That's a good point. So I think we're taking notes qualitatively as well. So if you feel that, oh my God, this is really, really important, if you wouldn't mind voicing that to me today, and then I can keep that. I will definitely, consider that when we get to the stats stage as well, and add that as part of the feedback that we got from the interviews. Is that okay? Awesome.
Any other last votes? If you don't want to vote, that's okay, right? If you do, yeah, anybody virtual, please unmute and let us know or use the emoji. Last call.
Okay. So moving forward, it seems like the next two
I have
questions.
a comment. Sorry, I came up with a comment. I have to say, I agree with the previous person who commented on the word match your face.
Mhm.
I think that question would sound better if the word match was suited your face. Because
Mhm.
what matches your face?
Mhm.
Like, blue eyes, blue face, they match, color
Mhm.
contrast. It's more, do your eye shape suit your face? And when you look at yourself in the mirror, that's what you interpret.
Mhm. So, funny context here for everybody. So, the original question actually in the face cue used the word suit. Why we ended up changing the word to match is because when we did the interviews, a lot of patients who had English as their second language actually didn't understand what suiting your face meant.
Fair
And
enough.
so, yeah, so that's why we changed it to match. We felt like it was the most similar-ish word, and it made sense for everybody. So hopefully that provides some context, but thank you so much for sharing that. And if anyone has any other comments, please don't hesitate to share them as well. Thank you. So moving forward to the next question, how much do you like the size of your eyes? It seems like we have consensus. Drop and pull, Natalia, drop. Natalia, did you pick drop for that first question? How much do you like how well your eyes match?
I did. Like I did the QR code one and I selected drop in that. So I don't know if I'm double voting if I did it already on the online forum thing.
Oh, I see what you mean. Okay, sorry. I should actually clarify myself here. By online voting, do you mean with the QR code, or do you mean the
Yes.
survey that I emailed to everybody yesterday?
The QR code.
QR code. Okay, let me just actually refresh. Maybe I
No,
don't
this should be fine
have.
because we have two. Yeah, that adds up.
Oh, okay.
No double counting.
Okay, sorry about that. And did you want to add anything else about that, or?
No, I just wanted to make sure that my vote was in there, so I won't double vote then. So if
Okay,
mine is already reflected in the QR code one, I won't vote a second time. Is that correct?
So the QR code is everyone's perspective before the discussion.
Gotcha.
And with the thumbs up and the paper and the physical thumbs up, this is for after discussion to come to a consensus. Is that
Got it.
clear?
Yes. Yep. Thanks.
Yeah, you're welcome. So for the next two questions, how much do you like the size of your eyes and how much do you like how your eyes look in photos? We will be skipping that because there is consensus already. Everyone thinks those are very important questions to ask. So let's move on to the next one then. How much do you like how your eyes look in videos? It seems we have one maybe, one drop, and 4 keeps. So if one person for each wouldn't mind sharing their perspective, I think we can all learn from one another.
Yeah, hi, it's me, Lynn. And I prefer to drop this question because it was a really like anxious question for me, because when I was young, in a young age, I was like liking myself in the mirror. But when I was like 20 years old, yeah, like I was anxious because I discovered in a very shock way that it's a totally different my face looked totally different from the mirror instead of the photos. It's look like the left right and the right left. I don't know if you got me. And this question, it's a little bit anxious and doesn't have any like I don't know what to say, like um, any result, any good result for you, in my opinion. So I'm sorry if I was rude or something, but it's yeah, it's a problem for us as an RB survivors.
Yeah, no, you are not rude at all. We are here today to get your perspective. And obviously, we don't want to be asking any questions that patients don't feel comfortable asking. So that perspective is really good. And thank you for that. So thank you for sharing your perspective on that, Lynn. Does anybody else want to share why they may have picked keep or drop or maybe?
Oh, sure, I picked drop because I felt that was a redundant question with the photo one.
Okay. Does anyone else want to share their perspective? Yeah, of course.
There you go.
Go for it.
Oh, I had said keep, and this is something that I've looked at or thought about often. Photos for me are a lot more controllable, and I can dictate whether or not I'm looking at the camera and I feel that I'm symmetrical. However, videos, I don't feel I have that control. It's one of my, and I think I share the concern with others in the community. It's one of the hardest things. Like I don't like being in videos because I don't have movement. So it highlights for me that I look disabled and I look like I'm cross-eyed and I can see what others see of me, and it's very uncomfortable. So videos are very much one that I would rate low on satisfaction, whereas photos I would rate somewhere in the middle. Sometimes I'm comfortable with them depending on how I look, but videos, never. I don't like. Did you want to say
No,
something
go
too?
for it.
All right, before moving on, I do want to just thank everyone for being vulnerable and open to sharing your experiences with everyone in a group setting. And I guess if no one has anything else to add, based on the discussions we've had, if you could all please use your papers or your thumbs up, thumbs down, hands up to share if now for the final consensus, you think we should keep the question, how much do you like how your eyes look in videos, if we should drop it, or if we feel neutral about it.
I'm dropped the question. Yeah.
Samreen, can you share with us verbally what you would like, what your preference is?
I would say I'm neutral on this one.
And did we get everyone? Did everyone vote?
It's interesting because I mean, at the end, sorry.
Oh, sorry.
At the end of the day, if we're thinking about creating discussions with clinicians, I guess what information is going to come from someone answering that they don't like their video or they don't like their eyes so much in a video? What is that communication or dialogue really going to elicit? So I guess in many ways, it's not necessary to ask both questions if we're looking to create dialogue, right? I mean, at the end of the day, what is a ophthalmologist or an oncologist or a whoever going to do or say to support someone to, if they don't like themselves in videos, what is the outcome or the conversation that can be had? So I can see how it would be redundant or extra for me when I'm emotionally attached to these questions, because that's what ends up happening a lot of the time. I feel my heart about the videos. I'm like, yeah, no, that's like a don't go there. So I can see why it may be redundant to ask that question. But I have a hard time letting go of it still, because I feel like it's very important for many members of our community. That's my 2 cents.
And I think that's okay, because sometimes people just want to be heard. And if this questionnaire is how people can be heard, then it's okay. And I feel like the application too, it's so wide. It could be used in clinical trials for any kind of new prosthetic eyes that may come out. It can be used, for any qualitative studies. The applications are so wide, it can be used by ocularists, not just in traditional clinic settings. So I think, if you feel passionate about it, then please include that perspective.
Any other thoughts? We're a small group, so if you don't mind, I'm going to ask you by your name. Natalia, if you wanted to share anything, or Scott, if you want to share something.
I would say that for me, photos and videos are different. So that's why I vote keep for the question.
Okay. So I think we have our final consensus for that question. So I'll move to the next one, mirror. Now I'm just wondering if the comments may be similar to the videos, but if they're not, if anyone has anything they'd like to add about the question, how much do you like how your eyes look in the mirror? Please feel free to share. We're all open ears here.
I'll say something. I think the difference between looking in the mirror and looking at a photo is your own personal perspective. In a photo, someone's taken a snapshot of time. You have no real control of how you look. You can decide if you like how you look or not, but in a mirror, you're more likely to diagnose yourself, to take yourself apart, to look at how you physically feel about how you look. And I think it's a little more impactful to your own psyche than it is just say, oh, yeah, it's a terrible picture. I don't look good in photos. As opposed to in the mirror, you get inside yourself and go, look at that eye. Look how droopy that eye is. I don't look symmetrical. I don't look like everyone else. And you're more likely to be a little harder on yourself.
Thank you for sharing that perspective. And yeah, I can understand that too. That's actually something that came in the interviews a lot. A lot of people were like, in photos and videos, sure, it's socially, but when I look at myself in the mirror, some people get triggered about all the experience they had before, whereas some people may have the perspective where it's like, it's okay, it's just me, so I'm more comfortable. So it's really interesting to see all the unique perspectives that everyone brings with these questions. I guess if no, do we? Oh, okay. Do we want to do a final?
I think
oh,
Samreen might have a comment.
Samreen, did you want to?
Yeah, I just wanted to say, well, for when I did have vision, I think for me the mirror and the photograph were pretty similar, because looking in the mirror, I know I look different, and in the photo, comparing to other people's this, yeah, I know I'm different, look different, so that was my take on it.
Yeah, no, thank you. Thank you so much for sharing that. I guess we can do our final consensus vote then for this question. So now, having heard the various perspectives from our room today, if you think the question should be kept, if you think it should be dropped, or if you think you're not sure, please reflect that with the emojis. Again, thumbs up for keep, thumbs down for drop, and hands up for neutral. We have our papers here as well.
I feel like
I'd say keep.
Yeah.
Thank you, Samreen.
Photo, you're different than everybody else. But in the mirror, you're, or you could have been in. Yeah, sure. Yeah, you know, like you could have your eyes shut when you take the photos, but in the mirror, you're looking, you're, what's what I'm looking for here? You're judging yourself, you're, you know, I don't look normal, that doesn't look right. You're looking at, you're giving yourself that breakdown. In a photo, it's like, oh, yeah, that was fun. And I think in the video, there's so much movement, it's easily, you're distracted, you don't focus on someone's eyes.
All right, so we'll be moving to the next question then. Excuse me, sorry. The next question was, how much do you like how your eyes look when you smile? So for this question, we had, let's see, we had 4 keeps, 1, sorry, 4 keeps, 1 drop, 1 maybe. So if anyone wants to share their perspective on this question, again, the question is, how much do you like how your eyes look when you smile?
Yeah, again, it's me. Actually, this question was so tricky for me because my prosthetic, I don't blink in my prosthetic. So when I smile, it's like being unnormal in my face. Like my face was divided in 2 parts. The first part was my normal eye, okay, blinking and everything, and it's fine. But the second part was in my prosthetic eye, it wasn't fine at all because I don't blink. I don't have those tiny lines beside my eye. So it's an unnatural look for me. That's why I don't like this question also.
Thank you for sharing that, Lynn. And again, thank you for being vulnerable and open to share your experience with all of us here today. Does anyone have anything else to add based on their experience? Or maybe to share why they may have picked their keep, maybe, or drop?
I picked drop just because I don't understand the context of the question. How do I like my eyes when I smile? Well, I don't know. I can't see my eyes when I'm smiling, right? Are you talking about in a picture, in a video, in the mirror? Like, what's the context of how I'm looking at my eyes?
That's a very good question. So I'll give everyone insights to what I've heard from the interviews I did. So yeah, some people were like, well, I don't look in my eyes when I smile because, you know, unless there's a mirror in front of me, how do I know what I look like? But other people were actually like, you know, when I'm just looking with a neutral face, you can really tell the difference between my prosthetic eye and my non-prosthetic eye. But when I'm smiling, you can't really tell the difference as much because my eyes close a little bit, and therefore it actually hides the differences. So that's kind of what I've heard from the interviews. I don't know if anyone else here has similar experiences or anything different that they'd like to add.
Sorry, but I have a small question.
Yeah, of course.
I need to know the interview. Did you have any patients that had any plastic surgery to their face?
For plastic surgery, I don't believe so. I think in our sample, we had individuals who had surgery to help with the prosthetic, like make more space so that it fits in. I've definitely had patients who had that surgery. I don't think anyone who got cosmetic surgery. I don't think we had that in our sample. But it is a good perspective that we should definitely look at in the testing of the questionnaire.
Yeah, because I had like a 3 plastic surgery, and you wrote in the yesterday the email that you
Yep.
sent for us. Yeah,
Mhm.
the past what I remember, the past 3 weeks, if I'm yeah. So I had a plastic surgery in the last 3 months. So that's why I'm questioning this is question. Yeah, and thank you for answering me.
Yeah, no worries at all. And that's so I'll actually take this opportunity to tell everyone. I think I emailed everyone a survey, which is really this questionnaire to complete before our workshop. And if you didn't get a chance to do that yet, please, if you wouldn't mind taking the time tonight to complete it before we continue with the workshop tomorrow. You'll see in the intake questionnaire, we ask things like, you know, have you had other surgeries that affect your appearance and things like that, because we need to take those into consideration to ensure you know, we understand why some individuals may answer some questions in certain ways. So thank you for pointing that out, Lynn. Anyone else have anything they want to share about the smile question? Okay, then if we're okay, we can do our final consensus vote. And I think due to time, that'll be the last one we do for today. So if you wouldn't mind, please using your thumbs up, thumbs down, or hands up to vote for whether you want to keep, remove, or you're not sure.
I don't know about that one. I accept how I look. I always look this way. How, you know, it's how I look.
And then you've got a beard, you've got other things that balance you out. May I just share a perspective? So I said before, I'm the healthcare professional.
Mhm,
I was at a concert a
mhm,
week ago with 2 other doctors and a non-doctor. So there were 4 of us. We were on level with the stage. And there were 5 wonderful musicians producing fabulous music.
mhm,
And I was the only one who noticed that one of the performers either didn't have an eye or had such a shrunken eye. And it wasn't until I brought it to the attention of the others and everyone had to look that they all realized there was something there. It wasn't what they saw. But I thought it was a fascinating thing that was just my professional area and nobody noticed. And they all knew what his role was. And so I think those, what other people see and what you see are not the same. And that this is really important feedback for us to hear about how people see themselves. So I appreciate it. Thank you for including me.
of course, thank you. And I hope, the purpose of making this phase of the project collaborative is also for everyone to learn from one another. Before I did this project, I knew nothing about retinoblastoma, but I can tell you I know a lot more than I would have learned from reading papers by simply speaking to patients and learning about everyone's unique perspectives. So, I want to thank everyone here for being open today and for being so great at participating. And thank you, Dr. Payton, for sharing your perspective as well. And I hope everyone found that they were able to learn something from someone today. So I think I'll end it here for today. I
Can I
just
make a
want to,
comment?
oh,
Can I make a
yeah,
comment as well? Based, kind of just extending what Dr. Payton was saying.
of
I'm
course.
almost 50 years old. I've had this issue my entire life. I have always had a droopy eye. I have just accepted this, and I think it's maybe an important question to add here.
Mhm,
The first question maybe should be, how much do you, or what level do you accept your appearance before you
mhm,
get into the nitty-gritty of what issues are wrong and what don't I like? How do you accept it? Because I accept that I look this way, and I go out in the world accepting that I look how I look, and my personality fills in the difference. When I meet people, I've never had an issue where someone, has pointed out, or, I mean, kids do, but that's what kids do. But I've never had a problem making friends, having relationships due to the way that I physically look. And I think that's something to consider, is your personality can distract that a lot, to the point where you can lead what's considered a normal looking life. You know what I mean? But I think your opinions on what the answers to these questions are strongly based on how much you accept your own disability and the outlook of it to everybody else.
yeah. You're completely right, and thank you so much for sharing that. And when you get the chance to actually complete the entire modified questionnaire tonight, so that we can further discuss it tomorrow, I'll send an email again to everyone tonight. Again, if you wouldn't mind, please completing it. You'll actually, oh no, okay, I'll try to be really quickly. You'll actually notice that there are questions that ask you about your psychological state, and there are actually psychosocial questions in there, and we weren't able to get to them today due to the time. But yeah, you're completely right. And that's exactly how we'll be able to make those comparisons based on people's perspectives. So again,
Okay.
thank you everybody today for your great work. And I look forward to continuing our discussions tomorrow.
Please come back
you.
tomorrow. We're going to continue the work. Okay, we're going to be meeting all back in the main room, and you'll be automatically brought back.